Yeah, just a quick review of the Vive hinged knee brace. So this brace is made specifically for people that have some type of knee problem or are suffering with some kind of knee pain. The idea here is that you put on the brace and it supports the joint and the surrounding soft tissues like the muscles around the knee, and it restricts your knee motion a little bit. So that way your knee has a chance to rest, recover, and doesn't get so overstressed as you're doing things. So a few points about this particular brace. This one's kind of interesting. I've never seen one exactly like this before. It does have a hinge on it, so that will give you good support, side-to-side support. But this one is interesting because this one actually is removable, so you can actually take it out and use it both ways. If you need more support, leave it in. If you need less support as time goes on, or you just don't need that, you can just take it out. So it's really that's pretty cool. And the other thing to know is that this is good for either the right or the left knee, which I really like that feature because a lot of times, maybe your right knee will be hurting you and you'll need it for a while, and then your right knee will be fine, and maybe down the road your left knee bothers you. Well, hey, you don't have to buy a new brace now, you can just use the same one. So anyway, really good feature there. So anyway, other things you can do if you're having a knee problem, I'm getting this from Bulletproof Your Knee. If you have any kind of a knee problem, make sure you get your quads strong by doing at least one exercise. Quadriceps, this is the group of 4 muscles collectively called the quads or the quadriceps. And as you can see, here's your kneecap just for reference. So there's 4 muscles on there. This is the big stabilizer of the knee. But what researchers are finding, if you have various knee problems, actually just about any problem you can name, probably show you a study where researchers have tested the muscles around the knee, and they're finding just a lot of weakness in basically just the quadriceps muscle. So for instance, let's say like knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So here again, if you have any kind of acute or chronic swelling, it's probably taking its toll on your quadriceps strength. Knee injuries in the quadriceps, if you like broken a lower leg bone, like your tibia, if you have any kind of surgery on your knee where they opened it up, puts you at risk for decreased quad strength. Here's a good ligament problems in the quadriceps, the anterior cruciate ligament. So that's the ACL. So you've heard of football players like tearing their ACL. So looking at this, one study looked at people who completely ruptured their ACL. Researchers found that strength of their quadriceps muscle in the injured leg was decreased by 25 to 30%. So here again, you're taking 25 or 30% of strength away from your quadriceps muscle. You're compromising a lot of knee stability. So it's really hard to get better and pain-free unless you get that back. Posterior cruciate ligament, same kind of thing. Medial collateral ligament, all those ligaments. Knee pain in the quadriceps. If you've had like a lot of chronic knee pain, probably puts you at risk for having decreased quad strength. Knee arthritis in the quadriceps. So if you go ahead and Google like knee arthritis and or knee osteoarthritis, either one, and quadriceps, it's very, very, very consistent in the research that if you have knee arthritis, you probably have some kind of quadriceps weakness. And likewise, if you take, these are randomized controlled trials now, plenty of randomized controlled trials saying that, hey, if you take a group of people with knee osteoarthritis and you strengthen just their quads, their knee pain starts to go away. And some of these studies are even finding that the people with the strongest quadriceps muscle have the least progression of their knee arthritis. So you got a lot of reasons to at least do one exercise for your quads. Patellofemoral pain syndrome, and this goes on and on. Just crazy. If you have any kind of a knee issue, basically make sure you're at least one exercise for your quadriceps. Fine-tune control over your knee. Here we're talking about mainly at the hip. Sometimes you can have really bad knee pain. Absolutely nothing wrong with your knee, but the problem is up here at the hip. So classic cases like iliotibial band syndrome. If you take a group of people with iliotibial band syndrome and you muscle test their hip muscles, they find that they have unusually weak hip abductors. Hip abductors keep your pelvis level every time you take a step, also bring your leg out to the side. So here again, like with knee arthritis, if you take a group of people with iliotibial band syndrome and you strengthen their hip abductors, the iliotibial band syndrome starts to go away. So that's kind of cool. Optimize knee flexibility. Well, we all know your knee has to be able to bend and straighten sufficiently. A lot of people don't notice that your knee actually rotates. So about the last 10 to 15 degrees of you straightening your leg, your knee actually rotates laterally. So here's a little test to see if you have that accessory motion. So that's actually, we call that an accessory motion. It's the motion that you really need for a fully functioning knee. So stretching can help iron that out. But you gotta know which stretches to do, how long to do them. Increase dynamic knee stability. And here we're talking about proprioception. So proprioception is your position sense. So let's say I suddenly turn out the lights. You probably could tell me whether your knee is bent or straight. And that's because you have joint receptors and little nerve receptors in your knee muscles. They give your brain constant feedback as to where your knee is in space. And so when researchers go around looking at people with various knee problems, they find their proprioception isn't really what it's supposed to be. Now it's not like they can't find their knee or anything, but it's just not what it's supposed to be, and another function of your knee that you can improve to get out of pain and get a fully functioning knee. But hey, nothing's as quick as putting on a brace. This is one of the more interesting braces I've reviewed. Really interesting with the removable thing. I really like that option. So good brace. Check it out.